So it's really important for you to keep track of your own myeloma, and this can get really confusing for most patients. There are a lot of labs and terminology that is totally foreign and new. So when we built HealthTree, we put only the relevant myeloma information that you need. So some of that includes current health situations, like do you have a heart condition, or do you have diabetes, or do you have things that would affect your myeloma therapy? Some of it is your fitness status. How fit are you? Doctors are dividing patients into fit, unfit, frail categories and giving treatment based on your fitness status. Another important piece of information is your genetics, and usually that's the FISH test. There are other more advanced genetic testing, but you want to keep that in your profile as well. And then your labs. You want to keep your labs separately, and then you might want to chronicle your myeloma journey and journal it and share the things that you're learning, even with other patients.
So I think it's important that you keep copies of all your labs. You can enter them into programs like HealthTree from Myeloma Crowd, Myeloma Manager from the IMF. You can create your own Excel spreadsheet. Don't really care how you do it. It's just important that you do it so that you become familiar with your normals, become familiar with the lab markers, become familiar with the trends of those markers, which can help you understand your myeloma status. It becomes important to have those records available when you seek second opinions as well.
Early on in the diagnosis, one of the things that you want is a baseline. What is your disease? So you would like, and this is something that you need from all of your healthcare professionals. Before you leave the office, you make sure you have a hard copy of everything that was discussed, all the tests associated with it. And if you don't get it there, make sure that you get it from either like a MyChart program or whatever the program is that the location has that provides you with the service, because you want all that data. Secondly, if you happen to be a member of HealthTree, you're going to provide that data into HealthTree, and as a result, you'll have it available to you. So, that's another great thing about that program. It provides you with a regimen of what you need to do in order to keep abreast of your information and how you respond to all the medications that you're on.
Keep track of your M-spike, keep track of your SPEP numbers. Definitely keep track of your creatinines to make sure that your kidneys are doing well. All that might seem overwhelming, but the more you learn about myeloma, these numbers, these names won't seem so foreign to you. It's really important that you track and keep good records of your own therapy, your own follow-ups, your own treatments, your own imaging.
Besides blood work, I think it's important that you keep records like your own side effects. How did you feel when you took dexamethasone? And what were your responses when you took Velcade and Revlimid? Did you become relapsed or refractory to a particular treatment option? So all of those things can be kept nicely, again, in HealthTree. I think it's a terrific application for that.
Every myeloma patient should keep their own records. You're going to be seeing several doctors. You need to keep track of all of your myeloma labs. You need to keep track of the imaging scans, MRIs that you've had. Sometimes medical records aren't transferable very well from one doctor to another, so you need to keep those records, specifically imaging and lab studies. Another source to really keep information together is HealthTree. Understand that process, know what you can do, and all the aspects of HealthTree that can keep those records for you.
So it's very common for many myeloma patients to be seen at multiple centers. You might go to your general oncology center to have your labs drawn or get the infusion that you need. And then you might go to the academic center quarterly or every 6 months, and you might get more of your detailed testing done. So you're going to have records in multiple places, typically in myeloma. And so HealthTree is a way you can put it all together. We'll be providing also the ability for you to give consent back to your doctor and your doctor will be able to see your information in HealthTree for a second opinion, or so they understand what's happening at the other clinic and they don't have to always request all the records. When it comes to lab value data, we are also going to provide a way for you to get that lab value data automatically, so you don't have to hand enter all your lab data and feel really overwhelmed, like, oh, this is too much information for me to try to put in. We're building an app called HealthTree Connect, and if your hospital is in Apple Health, you will be able to import your lab records automatically. So now you can keep track of information from multiple places on an automatic basis. And then you can go back and say, well, did the genetics of my disease change? And enter in that information. Or you can also upload the file if you don't understand the genetics types of reports, and we'll help you with that.
Once again, you can keep track of everything discussed in this video inside of HealthTree.